If you're only interested in short-term relief, and you don't care about the long-term results, then you can stop watching this video now. Some of these ideas we're going to talk about are controversial, and there are many docs out there that would disagree with me. So that's your disclaimer. I'll share my opinion shortly about the SI joint that most docs will likely disagree with. Corticosteroids like cortisone only provide short-term relief and don't provide any long-term benefits. Once in a while, once the medication wears off, the patient actually is doing better and the original source of pain is calmed down. More often what we see is that the steroid injection provides temporary relief, and once that wears off, the pain comes back. And then with continued steroid injections, the steroids provide less and less relief with time, to the point where it's no longer even worth doing the steroid injections. That's sometimes when folks will have the sacroiliac joint fused if they've been having steroid injections in the SI joint and these injections no longer work. So here's my controversial opinion. I think the sacroiliac joint is more of a secondary problem. What I see is that the sacroiliac ligaments are problematic first before the sacroiliac joint becomes problematic. So these ligaments can be damaged with a fall, lifting injury, or any other sort of trauma. Pregnancy can also cause some relaxation of those ligaments, putting a little bit extra stress on that area. When these ligaments are damaged and painful, anytime you stress or place an extra stress on those ligaments, the pain can be amplified, like certain positions, like bending a certain way or sitting a certain way. So the big question is, how do you tell what's what? A steroid injection is not a diagnostic injection. A steroid injection, even in the wrong location, can provide pain relief even to other sites throughout the body. So the best way to diagnose the sacroiliac joint versus the ligaments is to do a diagnostic block. If we're first looking at the sacroiliac joint, what we need to do is actually anesthetize the joint. I like to do this under x-ray guidance. We can put the needle right into the joint, put a little contrast in, and see that it's actually flowing within the joint. Then we put an anesthetic into the joint, and if the joint is the source of pain, the anesthetic will reduce the pain significantly, somewhere about 80%, 90%. Then we can confidently say the pain is coming from the sacroiliac joint. The way we test the sacroiliac ligaments is a provocative test. So essentially what I do is I take a needle and test a few spots of the ligament where I put the needle right into the ligament. And so what I'm doing is I'm seeing what the patient feels as I test that part of the ligament. If they say, oh yeah, that's my usual source of pain, and it actually refers in the same referral pattern that their pain typically refers down, usually down the buttock, down the back of the thigh, sometimes all the way even into the foot, then we'll document which parts of the ligament were most problematic. So it's somewhat of a barbaric test, but it's one of the best ways to test the ligaments. Sometimes we'll put some anesthetic into the ligaments as well, just for kind of a secondary test. If they get some relief, then that's some helpful information. It's not as diagnostic because there's because the lateral branches of the dorsal ramus can relay pain signals from the SI joint up to the brain. So if we anesthetize those, that may give us a false diagnosis of ligament pain. So if you're looking for a longer term solution to your pain, determining the source of the pain is half the battle. The sacroiliac ligament responds well to proper treatment, and we can see long-term improvement or even resolution of pain with proper treatment of the sacroiliac ligament. And that's something that we can't say about steroid injections. So check out this video. It talks about some treatment options for the sacroiliac ligament if it's a problem. Make sure to subscribe. Until next time.